Airline travel today is more affordable than ever and likely to be safer than ever too. Within half a day, a passenger can be on the other side of the world. However, medical care in flight has been an issue for those with medical conditions and for those who fall sick during a journey. While airlines have the advice of multiple recognized organizations on needs and standards of care, in-flight emergencies occur at various levels. An emergency medical kit, together with trained cabin crew, can be very effective at resolving arising minor problems and reducing the risk of escalation. On occasion, an overhead plea may be announced for additional medical expertise on board. Having the right content in a medical kit is more important in modern day travel, including an AED and an O2 pulse oximeter. And this, coupled with advances in other equipment and passenger expectations, is the norm. The authors all address current issues of illness and other relevant conditions arising during flight and suggest content enhancement for an onboard emergency medical kit.